Good afternoon, everybody. We're just going to give it a minute here while we allow more people to join on the call, and then we will get started. Okay, I think we'll get started now. Good afternoon, everyone. I'm Andrew Sorensen, spokesperson here at CU Boulder. I'll be moderating today's call. Some quick housekeeping before we get started. When we get to Q&A, you can place your question in the Q&A function at the bottom of your screen. We'll do our best to get to all of those questions. If we do not get to your question, you can reach us at colorado.edu/COVID-19. As a reminder, today's call will be recorded, and this recording will be added to our COVID-19 website. On today's call, we have Catherine Eggert, Senior Vice Provost for Academic Planning and Assessment, Jennifer McDuffie, Associate Vice Chancellor for Health and Wellness. She's also heading up our campus pandemic response office. We also have with us Dan Jones, Associate Vice Chancellor for Integrity, Safety, and Compliance, and Laura Arroyo, Director of Housing Administration in the Division of Student Affairs. I'll now turn it over to Catherine Eggert, who's going to get us started today with some opening comments.
Thank you, Andrew, and thanks to everybody who's joining us today. We are now into our second week of the spring semester, and we are remaining on track to, as announced, return on February 15th to our blend of in-person, hybrid in-person, and remote instruction modes. So what this means is that starting on February 15th, every class will be taught in the instruction mode that was listed when the students registered for classes. So if you signed up for an in-person class, for example, that class will be taught in person beginning February 15th. If you signed up for a remote class, that class will stay remote. So until then, until February 15th, we're continuing in fully remote learning. I'm really pleased to report that our faculty have worked to improve the online experience with assistance from our Center for Teaching and Learning. And in fact, I'd like to reiterate what the provost said last week. We've made a real point to learn the lessons of the fall semester and to apply them to this spring semester. We did a careful look with data compiled by our faculty experts at how successful our preparation of classrooms, laboratories, and learning spaces was. And we're very pleased to report that we did not, to date, have a single known case of laboratory or classroom transmission of the virus. So we're excited to get going with the semester and continue with our teaching and learning and research on campus. And with that, I will turn it over to my colleague, Jennifer McDuffie in Student Affairs.
Thank you, Dr. Eggert, and welcome everyone. It's been a very snowy but nice start to the school year. And as students start to prepare to return to Boulder, we are encouraging them to remain in their home communities until they start moving back into the residence halls or until our classes begin in person. Students can start moving back into the residence halls by appointment beginning on February 7th. In addition, our testing protocols for the spring semester have expanded. Those living on campus are continued to be required to test weekly through our monitoring testing program. Our students returning to on-campus housing should be accustomed to this, and we are so grateful for their participation. Additionally, we are asking our faculty, staff, and any students who come to campus for work, classes, research, or other reasons to participate in the monitoring on a weekly basis. New this semester, we have expanded our robust offering of incentives and participation for those who do participate in monitoring, as well as the Buff Pass. We like to have a very good experience, and we know that our faculty, staff, and students' participation in monitoring will help with that. Additionally, we have testing that is remaining open to our family and households. So any member of the CU community who has a Buff 1 card can bring in immediate family members and household members to monitoring testing. Our turnaround time is less than 24 hours or 1 business day. For information on testing sites and information about how we are looking at a comprehensive prevention plan, please visit our Protect Our Herd website. That's colorado.edu/protect-our-herd. Sorry about that. Finally, faculty and staff and students, please complete your Buff Pass every day. We've made a lot of expansions and look forward to having a more comprehensive testing and notification experience launch next week. We're really excited about having the ability to provide so much prevention and information today. And at this time, I'd like to turn it over to Andrew for question and answer.
Thank you very much, Jennifer. We want to give you all the maximum amount of time to ask your questions. If you have a question, please use that Q&A function at the bottom of your screen. We are prioritizing questions from students and family members, but we will again try to get to everyone's questions today. And if we do not get to your question, feel free to send it to us on that COVID-19 website with the chat at the bottom there. For Laura Arroyo, our first question, what kind of enforcement do you plan to do in residence halls to promote safety?
Hello, everyone. My name is Laura Arroyo. My pronouns are she, her, hers, and I'm the Director for Housing Administration. It's such a pleasure to be with you all this morning. We're doing a number of things to think about the safety of our students on campus. Mostly we're continuing with what we have done in the fall, as we've seen that there is real progress and real success in the ways that we have managed COVID and to support students. I think the most important thing was making sure that students were educated about the things that we were doing on campus, such as making sure that students needed to remain in their residence halls and that they weren't traveling and meeting with students within other residence halls in the other communities. So we're really expecting and asking that students remain in their own residence halls and continue to follow the safe guidelines of outside spacing, safety requirements and expectations to make sure that we're not managing spaces inside while we're also managing spaces outside. Now, the great thing about CU Boulder is that it's a beautiful campus and it's a large campus. There's much space for our students that are outside spaces, which make our spaces and opportunities on campus much safer. What I will also ask, like folks have said on this call already, the spread that we're seeing really is about student gatherings. It's less about students going to class or managing their academic experience. It's really about student gatherings. So we're continuing to ask students to make as safe of choices as possible, both in their residence hall as well as in the greater community, because our impacts spread not only to our students and to each other, but it also impacts the Boulder community as a whole. So to recap, I think really continue with the things that we have already done. If you're a new student, we'll be communicating those policies and procedures and expectations out to you to make sure that you're aware as well as a new student of what we're asking of you.
Wonderful. Thank you so much. Question here for Jennifer McDuffie. What does the campus expect, or sorry, when does the campus expect to receive the vaccine? How much will be distributed and who will get it first?
Oh, wow. Very good questions. And so I want to make sure I answer all of them. When it comes to vaccine distribution, there are many variables that are outside of CU Boulder. And some of those include supply chain and state distribution and prioritization, as well as Boulder County Public Health or our local public health agency. We are very fortunate to have great partners in all of those places and spaces. And CU Boulder is one of the providers in Boulder County Public Health network. So we're one of, I believe, 30-ish, 31, 32. At CU Boulder, we have received a very small amount of vaccines at this point, less than or approximately 300 total. And in terms of distribution and eligibility, we are following state guidelines. So those who are in phased 1A or 1B above the line. We recognize that we have many people in this population and have worked very closely with partners in human resources, institutional research, as well as others to help ensure that we have outreach to people who could be on the receiving end of the vaccine. But we also recognize we're getting a lot of questions about educators. And as a state, we do not have guidance yet as to what educators mean, especially in a higher education setting. So we continue to provide information in our Thursday updates to the campus and as well as on our vaccine website, but recognizing that this is a changing landscape. And no matter what we do, we're going to follow state and local guidance.
Wonderful. Thank you. A question for Catherine Eggert. What are you hearing from faculty about teaching online? Do you expect CU Boulder will offer more online options moving forward?
So first thing I have to say is that we've been really proud of our faculty for adapting to these unforeseen and unprecedented circumstances over this pandemic, and proud of our students too for helping and cooperating and participating with our faculty in improving the delivery of courses through remote and online means. Now, nobody knows better than our faculty that online teaching and learning present unique challenges, but also unique advantages. So they've been working to be as flexible and responsive as possible in trying to deliver a quality educational experience and a supportive academic experience for students. I have to say that our new Center for Teaching and Learning has been a tremendous partner in this effort, and faculty have been consulting with the Center for Teaching and Learning in record numbers to participate in seminars and workshops and consultations about how to deliver online learning more effectively. So moving forward, I think that we have an opportunity to learn lessons about remote teaching from this experience and lessons about making delivery of our education more flexible. And I look forward to working with the faculty on that, because it's the faculty who are responsible for delivering the curriculum and a quality education.
Okay. And another one for you. What % of courses do we expect to be online this semester? This person says, my son has 0 in-person/hybrid courses for 17 credits. Thanks.
I'm sorry to hear that if that wasn't your students' preference. We are offering this semester actually more of our classes in person than we did last semester. We're at about 30% of our classes are fully in person once we come back to campus, of course, on February 15th. So 30% in person, 20% hybrid. So sometimes in person, sometimes remote, and the rest, the other 50% are online or remote. It's important to stress that our faculty really wanted to teach in person, and we are vastly limited by the capacity of our classrooms with social distancing requirements and with capacity limits set in place by the state of Colorado. We can only fit so many people in a classroom and remain within the law. So that has really restricted our ability to offer as much in-person teaching as we wanted to. And that's just a fact of the pandemic and a fact of how we need to mitigate the spread of the virus.
Thank you very much. Question for Dan Jones. If COVID-19 increases dramatically, will you go fully remote again?
Thank you for the question. And, certainly, as has been discussed previously, we're operating within the framework that the state has laid out, the governor has laid out. So, any decisions about going fully remote would be made in partnership with Boulder County Health and our partners there. Thank you.
Thank you very much. Another question for Jennifer McDuffie. Did I hear that students housed off campus will only be encouraged to participate in testing instead of being required to participate?
Andrew, that's a very good question. We are encouraging all people who are coming to campus, faculty, staff, and students to test. There are certain groups off campus that we are working on through risk mitigation plans. If they're living in groups of 5 or more, to have a much different experience. And what we found is that testing is one component. And so what we want to make sure is that we have a holistic approach where testing has the capacity, but we also recognize that it's much more than just testing. It's the ability to work with contact tracers and case investigators. It's the importance of working on, minimizing gatherings and other large group activities. And so at this time, we are looking at that holistic approach for, like I said, the public health measures, which does include testing.
Thank you. And another question for you. My dorm student has allergies. Which vaccine will CU be distributing?
That's a really good point, and a very interesting one right now, because there's currently 2 vaccines that we're able to receive as the state under our emergency use authorization. That's Pfizer and Moderna. At this time, we're not able to request a preference, and we'll distribute, whatever vaccine we're able to. I think the important point to note is timing. We're very anxious and excited to get vaccines to people who want them and or need them. And I think our timeline right now is a bit long-term versus short-term. So I think for most of our students, we may not be looking at vaccines, as early as mid-March. It may be later in the spring. And so to the parent who asked that, it's a very good question. And I would say that when it does become available and when we're able to talk about, students and other populations, that sharing any kind of personal information with the medical provider is going to be critical.
Great, thank you. A question for I believe, Devin Kramer here. How do you plan to handle students who ignore public health orders and have large gatherings?
Hi, everyone. I'm Devin Kramer. I'm the Assistant Dean of Students. We plan to continue to partner with CU Police Department and the Boulder Police Department as we did last semester. When we do receive reports of alleged violations of particularly hosting large gatherings, the Student Conduct and Conflict Resolution Office will quickly start a conduct process and engage in a hearing with those students. If found responsible for hosting a large gathering, the very likely sanction is a suspension for a semester from the institution. So we really want to make sure that our students know that there could be significant consequences for hosting large gatherings. For other types of violations of our infectious disease policy, we have various other consequences that we can implement, including education with our students. And I want to encourage everyone, if you see a student hosting a large gathering, please report that to the police, as that's the best way for us to get the information we need.
Thank you very much. Here's a question for Jennifer or Dan. Will testing requirements be different in the spring from the fall? Will you require testing for all students, faculty, and staff?
You want to take the lead on that, Jennifer?
Oh, thank you. Just to confirm, Andrew, the question is, will we be requiring all faculty, staff, and students to test? Is that accurate?
Yes.
So we are asking for participation, and there are individuals that are required to test. Those individuals who are faculty and staff have been notified, and we have worked with their human resources departments to ensure the compliance with that weekly requirement. Students who live on campus are also required to test, which is similar to the fall. And for others, we have been working with congregate group homes and other people who are living in more dense environments to highly encourage and in some cases require, but it is not for all faculty and staff. We are asking for participation and incentivizing. And just for awareness, we've had a significant amount of turnout for our monitoring as well as our diagnostic testing. Dan, would you want to add anything else to that?
I think this is a good opportunity to also mention the buff pass that, and as we integrate more technology into our response, there'll be more information about reminders about testing and in the program as part of that. So certainly faculty, staff, and students are strongly encouraged to download that on their phone or just access it through the web.
Right, thank you. Another question for Jennifer. Apologies if already asked. This person joined late. How many vaccines has CU Boulder Medical Services distributed, and to whom?
So it has not been asked that specifically. We have received 300 vaccines to date. They have not all come at one time. We are in the process of distributing 100 of those vaccines this week. The categories or eligibility would follow state guidance, and it would be with 1A classification and 1B above the line.
Okay, and a related question here. Will dorm students get priority for the vaccine due to their high population living environment?
That is a very good question, and definitely one we cannot make without the state and local public health guidance. And if you're asking, and following Colorado news, congregate housing continues to be a conversation. Who does that entail and where the priority lies? We are seeking guidance on the clarification of that. And as soon as we have it, we will absolutely update our website. But again, that would follow the state and local public health guidance.
Great, thank you. And we'll put out a last call for questions here. Before we wrap up for the day. Okay, we do have one more. Are graduate student TAs and researchers eligible for vaccines when the state enters phase 1B, which includes frontline essential workers in quote unquote education?
So, Andrew, I think I can take that. And then obviously, Dr. Eggert, if I miss anything, please fill in. We are still waiting on guidance around education, or educators, excuse me, from the state. But at CU and in working with our local public health agency, we do believe anyone who is in an in-class setting, pardon me, who is teaching, regardless of graduate student, adjunct instructor, whomever, if they're in that in-person classroom setting, that they are essential for our operations. Again, though, I think it's really important that we focus and rely on the state to provide guidance around educators, as we must align as a provider with the state.
I have nothing to add to that, Jennifer, just to say that we value all of our personnel who are working in teaching and research, and will not, as Jennifer mentioned, will not differentiate among them according to their employment status, whether they're a TA, full-time instructor, it doesn't matter.
Okay. Thank you. Well, thank you all for joining us today. If you have further questions or would like to see additional information, you can do so by visiting our COVID-19 website. That's colorado.edu/COVID-19. There's a chat at the bottom right-hand side of that site where you can ask questions. CU Boulder will host another update session on Tuesday, February 2nd from noon to 1 p.m. Mountain Time. These updates will occur on a weekly basis throughout the spring semester, with the last webinar currently scheduled for Tuesday, April 27th. Boulder County Public Health is also hosting community briefings this year every Wednesday at 3:30 p.m. BCPH's agenda for these meetings moving forward is to provide updates to the Boulder County Health leadership, updates to public health professionals on current topics like vaccines, testing, and data, and updates from local partners. Lastly, the City of Boulder does once a month briefings on the third Thursday of every month from 3 p.m. to 4 p.m. Mountain Time. We'll now end this call. Thank you for joining.